Today we are going to talk about albendazole. This albendazole is a congener of mebendazole, which is a broad spectrum antihelminth. Albendazole, which is a congener of mebendazole, and it is a broad spectrum antihelminth. This albendazole is a prodrug and it is converted into its active metabolite. The name is albendazole sulfoxide. It has a good efficacy against roundworm, hookworm, pinworm, threadworm, tapeworm, trichuriasis. This albendazole is also useful in the hydatid disease and as the active metabolite penetrates the hydatid cyst. Why it is useful in hydatid disease? Because this active metabolite of the albendazole, it can penetrate that hydatid cyst. Albendazole has actions and mechanism of action similar to the mebendazole. It is almost similar to the mebendazole. For example, the mechanism of action that we have, yes, albendazole or mebendazole, they will act by similar mechanism. Which mechanism? They will bind to the beta tubulin of the parasite. They inhibit the synthesis of microtubule, so that these microtubules are very important factor for the metabolic process of the parasite. So if we inhibit this microtubule, there is a death of parasite or there is a death of worms. And apart from that, they decrease the glucose uptake of the parasite and ultimately there is a death of parasite or that worms. So this albendazole, mebendazole, they act by similar mechanism. They act by similar mechanism. Now what are the advantages of albendazole over mebendazole? The active metabolite of albendazole achieve higher concentration than mebendazole. It achieves very high concentration, 100 times more than mebendazole. It's an advantage. The active metabolite of albendazole achieves higher concentration, almost 100 times more than the albendazole. Albendazole is better tolerated and it is effective in single dose in most of the infection. Only single dose 400 milligram OD is sufficient in most of the infection. So this is the advantage. It is superior to mebendazole in hookworm, threadworm infection, hydatid disease and neurocystis orchosis. It is superior to mebendazole in which infections like hookworm, threadworm, hydatid disease and neurocystis orchosis. Albendazole has some activity against Trichomonas vaginalis, Giardia lamblia and Wuchereria branchioftia, that is the causative agent of filariasis. Means this albendazole has a broader spectrum against Trichomonas vaginalis, Giardia lamblia and Wuchereria branchioftia. Pharmacokinetic properties. It is rapidly absorbed from the gut and fatty food enhances its absorption. This albendazole is rapidly absorbed from the gut and fatty food enhances its absorption. But this albendazole is given on empty stomach for treating intestinal worms. If you want to treat the intestinal worms, it is given on empty stomach, while for the parasites which are present in the tissue, albendazole is given with a fatty meal. If you want to treat the intestinal worm, it should be given on empty stomach. If you want to treat the parasites in the tissue, albendazole should be given after fatty meal or with fatty meal. It penetrates well into the tissues including CSF and hydatid cyst. It can penetrate or it can reach up to the CNS. It can cross blood-brain barrier and it can penetrate the hydatid cyst also. It will get rapidly metabolized in the liver and excreted in the urine. Various brand names like Zentel, Bandy 400 mg chewable tab is available or 200 milligram per 5 ml suspension which is given in the pediatric age group. You can give this in the pediatric age group. Mebendazole is not given in less than 2 years of age. Now adverse reaction, GI symptoms like nausea, diarrhea, abdominal pain, headache, dizziness, allergic reactions can also occur. But high doses used over a long time, it may cause jaundice, fever, weakness, alopecia, sometimes granulocytopenia. Albendazole is a teratogenic in animals and therefore it should not be given in pregnancy. It should not be given in pregnancy, but this albendazole can be given in children's or pediatric age group. So where we can use this? Albendazole is used in the roundworm, pinworm. Albendazole is a drug of choice in the roundworm, pinworm infestation in a single dose of 400 mg. Just give one tablet of 400 mg once and that's all. Dose should be repeated after 2 weeks in pinworm infestation to prevent the reinfection from the ova that mature later. Means in case of pinworm, you have to repeat the dose 400 mg after 2 weeks to prevent reinfection, because ova that mature later, so it can reinfect. So after 2 weeks you have to repeat the dose. Then trichinosis, hookworm, tapeworm, strongyloids require 400 mg daily for 3 days. In these infections you have to give 400 mg daily for 3 days. Then neurocysticercosis, its albendazole is a drug of choice in a dose of 400 mg twice daily, but the duration depends upon the number of cysts and may vary from 8 to 30 days. In case of neurocysticercosis, 400 mg twice daily, and the duration of treatment depend upon the number of cysts, and that duration of treatment may vary from 8 days to 30 days. Glucocorticoids should be given before starting albendazole to prevent immunological reactions to the dead parasites. That dead parasites can release some toxin and that may lead to some reactions, Mazotis reactions. Glucocorticoids are given to prevent that reaction. Hereditary disease. Albendazole is a drug of choice in hereditary disease because it can penetrate that cyst. 400 mg twice daily. It is given for 4 weeks. If needed, the course may be repeated after 2 weeks. When the cysts are removed by surgery, albendazole is more effective in providing cure. When that cyst is removed surgically, after that, this albendazole is more effective. Filariasis, combination of albendazole 400 mg with DEC 6 mg per kg or ivermectin 0.3 mg per kg given as a single dose is found to be very effective in Wuchereria bancrofti in suppressing microfilariae for 1 year. This also prevents the spread of filariasis and may be continued once a year for 5 to 6 years. So these are the therapeutic uses of albendazole.